Hi everyone, welcome back to my channel. If you're new here, my name is Steph. I'm a cosmetic nurse based in Melbourne, Australia. And today I wanted to talk about the risk and side effects with cosmetic treatments. As the patient, it's very important for you to know what the risks are and what side effects you could expect from the cosmetic treatments you get. At the end of the day, these are elective procedures and you're not required to get these treatments. It's important that you know all the information before you make your informed decision. For us nurses, it is our responsibility to educate our patients on what we could expect, what could happen, and how do we plan to manage these reactions. The risks and side effects do vary from one person to the other, so it's not all going to look the same. So it's very important to know in detail all the things that could happen, just in case. So some of the common ones that happen is usually redness, swelling, and bruising. Redness and swelling is very common and generally goes away on its own, but it's dependent on different factors. For example, using a needle versus a cannula, that could affect the swelling, but at the end of the day, we are still puncturing the skin, which causes trauma, and where trauma is, there's always redness and there's always swelling. If the patient has had any caffeine or had any alcohol 24 hours or right before the treatment, that can definitely affect how much they get red or how much they swell. This is also in relation to bruising. Now, bruising is a very common thing that happens because we do puncture the skin. Now, there's more than 1,000 tiny blood vessels all around the face, and it's very difficult to pinpoint exactly where they are. So I always tell my patients, bruising is always a risk. So it's very important to think about any special occasions you might have in the future, and do not do any treatments even before a week of the occasion. Always consider the time of when you do the treatments and how would this affect your day-to-day life. Another potential side effect is an infection. As we are opening the skin, that could be a vessel to germs and bacteria going in, causing and leading to an infection. What you can do as the client is to come in as makeup free as you can to make sure that there's no extra bacteria or germ lying on the skin that can lead to an infection. As the nurse performing the treatment, it's also very important that we clean the area very thoroughly before we do any procedure to make sure that it's nice and clean, and to also, of course, perform a hand hygiene. For volume restoration procedures, vascular occlusion can be a risk and a side effect. What is vascular occlusion? This is when the filler gets injected into the blood vessel, which could be your artery or your vein, which then causes a blockage to the blood flow. That means that oxygenated blood can't travel throughout parts of the face, and in rare cases it can lead to necrosis, which is when the skin cell starts to die, they turn black, and it can lead to blindness. So those are the very serious side effects that could potentially happen with fillers. There's signs and symptoms such as blanching, vision changes, any unfamiliar color changes within the skin, which are very important to monitor. And if you do start to see any of these, make sure to reach out to your cosmetic nurse or doctor so that they can assess and intervene as appropriately. There are ways to manage a vascular occlusion, but it's very important that it happens as soon as you recognize the signs and symptoms. So there's an enzyme called hyaluronidase, which can break down the hyaluronic acid gel or the filler injected, which is then reabsorbed back into the body. But it's crucial for you to know the signs and symptoms so that we can act straight away. For anti-wrinkle treatments, it has been reported in some people that a brow ptosis or a lid ptosis, which is a dropped brow or a dropped lid, can happen. When this happens, this is generally because the medication has been injected into the wrong muscle, or it has migrated to the unwanted area that we didn't want to treat. If this has happened to you, ensure that you call or you message your cosmetic nurse or doctor so that they can reassure you and advise you what you can do. But it's also very important to follow your aftercare instructions to avoid this as well. Late onset reactions to the medications we use can also be a possible risk and side effects, especially when someone is feeling unwell. The immune system is not quite as healthy as we want it to be. They respond by attacking any foreign bodies that is in the system. This can show whenever you have a cold or a flu, if you're feeling really unwell, areas of where you had getting the treatment done can swell up a little bit more. So if you're feeling sick and unwell, let your cosmetic nurse know and maybe hold off on getting your treatment done so that this can be avoided. Of course, it's sort of hard to determine how your body responds to the medications we use. So there's always that possibility that you'll get an allergic reaction. I have not come across an allergic reaction with the medications we use, but that doesn't mean that it doesn't happen. So always make sure that you go through your medical history with the nurse or the doctor that you see to rule out any potential reaction. Another risk that could happen is that you get an undesirable outcome. So this could mean that the results are not exactly how you want it. This is because of a number of different things. So every face is different and there's not one identical face that we see. It's very hard to get the exact same result that you might have seen on Instagram or on Facebook to reflect that onto your face. As a nurse, it's very important to set realistic expectations for a client, to not overpromise a service and risk that rupture in relationship and trust with your client. So those are some of the risks and side effects when getting cosmetic treatments done. Things to consider are to find a cosmetic nurse that you feel comfortable with to answer all of your questions. Make sure they talk about the risks and all the side effects, what could happen and how they plan to manage that if it occurs. So I hope you guys learned something from today. Thank you so much for watching and I'll see you in my next video.